In this lecture, we are going to discuss human herpes virus 6, the most important agent of the Roseola Infantum. We will discuss in detail the different aspects of the human herpes virus 6. So let's get started. First of all, we will look at the structures of the human herpes virus 6. So basically, it is an envelope virus. Okay. So outside, you will see the presence of the envelope, and inside you will see the presence of the capsid, and that capsid is actually icosahedral in shape, means 20 sides. Okay, and inside the capsid you will see the presence of the double stranded DNA molecule. So this is the basic structures of the human herpes virus 6. Human herpes virus 6 has two variants, A and the B. So it has two variants, human herpes virus 6A and human herpes virus 6B. But the B variant is the most common cause of the Roseola Infantum. So what type of cells will be affected by the human herpes virus 6? So two most important cells. First one is the lymphocytes. Lymphocyte. It includes both B and the T lymphocytes, and you can also see the monocytes as well. Monocyte as well. Okay. And if we look at the transmission, how human herpes virus 6 transmit from one person to another, so most importantly, it transmits through the saliva, through the respiratory droplets. Okay, because virus is actually present in the saliva of the infected person. Okay, so most important disease caused by the human herpes virus 6 is the Roseola Infantum, or you can say exanthem subitum or sixth disease. It is mostly seen in the early life from 6 months to 3 years of age. Okay, in that case you will see first stage of the roseola is the febrile phase, in which you will see the high grade fever. So fever will be 40 degrees Celsius to 104 Fahrenheit. You will see the high grade fever. Okay, and that will last 3 to 5 days. The febrile phase will last for 3 to 5 days. And in the febrile phase, you will also see the malaise, fatigue, conjunctivitis, redness of eye, orbital edema, swelling around the eye, inflammation of tympanic membrane. Tympanic means ear drum. Okay, you can also see the cough and the upper respiratory tract infection, bulging fontanelles, that is the present in our skull. And next is the Nagayama's spots. These are basically the vulvopalatoglossal spots. These are vulvopalatoglossal spots. You will see the macular spots on the soft palate and the uvula. So that is the Nagayama's spots. Nagayama's is basically the Japanese physicians that actually describe these spots. Okay. Next, after the febrile phase, you will see the afebrile phase. In that case, you will see the maculopapular rash. And these rash will be red or pink in color. So in that case, the rash first of all appears on the trunk, and then it will goes towards the extremities, like on the hand and the leg, or you can say the face. Okay, but in immunocompromised patients, because virus can be latent in the lymphocytes, and in the immunocompromised patient, this virus can become activated again and cause different complications like the pneumonia, encephalitis, and the hepatitis. Okay, if we look at the lab diagnosis, so mostly roseola is diagnosed clinically, but you can also go towards the lab diagnosis. So in that case, you will go towards the PCR or antibody detections, IgM. Okay. And last is the treatment. So in the treatment of the roseola, you will go towards the sportive therapy. Sportive therapy, like for the fever, you will go towards the acetaminophen, and you will go towards the fluid replacement. So these are basically the sportive therapy for the roseola infantum. So this is all about the roseola infantum. If you still have any question, you may ask in the comment section. Thank you so much.